Good evening, and welcome to Weight Loss Medications and Muscle, Bone, and Joint Health. During this webinar, we're going to explore the impacts of weight loss medications on musculoskeletal health and what patients should know about these medications. I'm pleased to welcome our panelists this evening. Dr. Elaine Kong is an attending physician at HSS and is board certified in endocrinology, diabetes, and metabolism. She specializes in the evaluation and treatment of patients with endocrine conditions with particular interest in bone health. Sue Yu is a clinical nutritionist and a certified diabetes care education specialist with a certification in adult weight management. Here at HSS, Sue works with patients with spine, hip, knee, and shoulder disorders, RA, scleroderma, lupus, diabetes, you name it, in outpatient setting. Thank you for joining us tonight. So we're going to get started with our first part, which is understanding GLP-1s and the health effects. So what are GLP-1s and how do they work?
Okay. So they're peptides that act on the gut receptors called GLP-1 receptor. And when they act on these receptors, it helps lower the glucose after a meal. It also delays stomach emptying. So people often feel more full and less hungry after the meals. And people like it because it helps with weight loss.
Yeah. And also those GLP-1s or hormones are generally found in the gut. So just to let people understand what GLP-1s are and how that affects gastric emptying of food, because those hormones are typically found in the gut.
Right. And this is in contrast to the other weight loss medicines that worked on neurotransmitters.
All right. So what are the different types of GLP-1s? And really, how do you figure out which one is best for a patient?
Right. So there's once a day ones, which are the earlier ones, like liraglutide. And then there's the once weekly formulations, which are more popular for clear reasons because you inject them less frequently. So those are semaglutide and tirzepatide. And they as they've come out, the more recent ones seem to be more effective for weight, and also the latest one, which is the tirzepatide, does seem to have slightly lower incidence of side effects. Although everybody responds very differently, so if someone is having a very good response on one, they sometimes have weight gain when they try to switch to another. So usually, if someone's having a good response, we tell them to stay on it. But if someone is not having as good of a response as they'd like or side effects, then sometimes I try switching to tirzepatide to see if they'll tolerate that better.
How do you know who is a good candidate for a GLP-1?
Well, it all depends on the guidelines, who should be on it. Anyone with a body mass index, a BMI of 30, or anyone who a BMI of 27 but with one or more weight-related comorbidities.
And is insurance, because all of these medications that are prescribed, I know, a lot of people say physician prescribed, but there are a lot of NPs, PAs, DOs out there prescribing. So is insurance covering these medications?
Depends on the indication. But in addition, for the weight indications, then if someone has diabetes or obstructive sleep apnea, then it could be covered.
Okay. Are there contraindications between these GLP-1s because there's so many of them and common medications people are taking?
I think the most common one, especially for somebody who uses GLP-1 for weight management in addition to having diabetes, the most common side effects in terms of people who have diabetes and who are on diabetic medication is hypoglycemia, which is having low blood sugar. So folks who are on diabetes medication needs cautions on those medications. Oftentimes, their doctor might need to adjust or lower the dosage on their other diabetes medication.
Right.
So I think I hear a lot about, I'm going to be on this medication for a long time, or some people think I'll just be on it for a little bit of time. Are there contraindications or really concerns someone should have with the long-term use? And is there a safety issue?
Well, it has been used a long time for people with diabetes, and it's often felt that it's like treating it like a blood pressure medicine or cholesterol medicine, in that it has the effect while you take it. It will go away if it stops. So we do tell people to think of it as a long-term plan in addition to diet and exercise.
Okay.
When people want to go on a maintenance dose, sometimes they try to lower it or give it less frequently.
Yeah. In terms of GLP-1 medication, it is being FDA approved back in 2005 for type 2 diabetes. The first medication came out, it's called exenatide, is known in the market as Byetta, is for treatment of type 2 diabetes. It's been around for 20 years now. So we do have data on safety of those medication. It is not was not used and not meant to be
Right.
used for weight
Weight loss,
loss.
yeah.
But now that we have data and the safety of those medication, and to be honest, right now looking at GLP-1 comparing to other weight loss medication, GLP-1 does come out on top in terms of safety. Seem to have fewer
Well,
side effects
right.
and
And also comes out on top in terms of efficacy with the newer ones.
Okay.
With the
right.
tirzepatide, it can almost be equivalent to the response with some of the bariatric surgery procedures. Yeah.
It's definitely cheaper. So
Yeah.
Than
with
having
no
surgery.
Yeah.
post-operative recovery. So part 2, we are at HSS. So let's talk about the impact on musculoskeletal health. So first, I think is, so what effects do these medications have really on the appetite?
Yeah, so GLP-1, their job is to suppress your appetite, to delay food emptying, which means the food will stay in your gut, in your stomach for extended period of time, so that you will have this sensation of fullness. So that is the effects of it. So it has lowers your appetite just because the food stays around a lot longer.
So if it is suppressing appetite, which is what it's supposed to do, then how are patients getting or supposed to get all the nutrients they need?
So
Since
that's
we always want them to get it from food. So,
I think that's why to be honest, any patients who be placed on a GLP-1 should consult with a professional such as like a dietitian. Just because those medications suppresses appetite significantly, there is a huge concern about protein intake. There's a research shown that anyone who on this medication, they can potentially lose 13.9% all the way to 40% of muscle mass. That's a huge number. And it's also a huge range of percentage of muscle loss. So with that said, there is such a concern because somebody can develop what we call sarcopenia. Sarcopenia is a condition that usually associated with the elderly. It is a loss of muscle function and muscle mass, and so that actually leads to weakness. All right, when
and
you
so then that will negatively impact bone
exactly
health or
what
musculoskeletal
Right.
health, right?
because
Increased
somebody
fall
right,
risk,
there's a huge risk
fracture.
for falls, right? That can increase risk for fractures. So there's a whole risk.
Right. Nobody's thinking of that. They just, trying to get into that dress or trying to get into,
Right. And
get a certain weight or a
right.
BMI.
Since
Yeah.
Right.
since it does suppress the appetite, then it's important the dietitian and the patient comes up with a plan where the nutrients are healthy and not just lower calorie but non-nutritious. Right.
Exactly. I mean, it's still very important to eat well-balanced meals. And when you don't have much appetite, that's what the medication makes you feel. It's even more critical to emphasize on eating certain nutrients first. For instance, I often advise my patients, well, if you don't have much appetite, you need to focus on eating your protein food first, just to prevent from significant muscle loss.
So are there then with the GLP-1s a risk to specifically or targeting like muscle and joint health?
I think it's more through the weight loss than the GLP-1 specifically.
Right. So it's not like I'm going to take a GLP-1, I'll lose weight, my knees or my hips or whatever is the problem. It's more of everything that's protecting of the skeleton that is
Right. So
problematic.
in the studies when people were on GLP-1s, if they combined strength training, muscle training, it helped protect the bone mass.
Yeah, and there actually a research paper came out how GLP-1 actually improves bone mass
Well, I
because of
think
the weight loss. in a
Mm-hmm.
way, but at the same time, rapid weight loss can
Right.
also decrease bone density. So what they saying, Dr. Khan, I just mentioned
Mm-hmm.
about the importance of exercise,
Right.
like especially weight training or resistance exercise, coupled with having good nutrition, having adequate protein intake, can mitigate that significant weight muscle loss. And also, because if you are combining the exercise component along with the diet,
Mm-hmm.
that also improves bone mass too.
Right.
Right, good old
Exactly.
weight bearing exercise
Mm-hmm.
activity, right?
Yes,
Right.
Yeah.
exactly. And good old weight bearing.
All
Yeah.
right.
So strength training is very important. So who's somebody who's a, a exerciser, who an
Mm-hmm.
avid exerciser, just not just doing cardio
Right.
exercise is just the only thing to emphasize, but also doing some weight
Right.
Right.
training too.
Strength.
Yeah.
Yeah.
Yeah. And the
Mm.
studies of the exercise, people who only did aerobic um, had weight loss, had loss of bone mass, but people who did strength training
Mm,
mixed with aerobic, their bones are maintained.
mm, mm. And balance, I'm assuming, is a part of that
Mm-hmm.
too. Yeah.
Right.
Absolutely.
Yeah.
Balance is a big thing, right? Especially among elderly populations.
Mm-hmm.
Having good, adequate balance will prevent them from falls.
Mm-hmm.
Mhm.
So that is the end of
Mm-hmm.
our kind of questions that we had lined up. So if the audience has any questions, I feel like they're probably 3 or 4 that I'm thinking off the top of my head that somebody is going to have.
Fine.
So, okay, we have a question. Can you address the use of GLP-1s for someone who has an existing joint replacement? I have a total ankle replacement from HSS for 13 years and wondering if there are any issues with loosening of the implant or loss of bone affecting the implant.
Right. Okay. Um, so yeah, usually a recommendation for anybody with bone issues in GLP-1 is to focus more on a gradual weight loss rather than a rapid weight loss.
We want your
Mm.
obviously your implants to last as long as possible, but if they're yeah, and I think with aging, and it just depends on what your weight bearing is, what your
Right.
overall bone health was,
Right. And
to
then the other important part of maintaining the muscle mass to help everything stay in
right.
place.
Right. I mean,
Mhm.
it's a very non-answer because we're not saying it's not related, but we're not really saying it's related. It could be related, is sort of what we're kind of saying.
Mm.
Next question is, should patients on GLP-1s get bone density tests? Will low bone mass show up on a bone density test?
Well, low bone mass will show up on a bone density test. That's the class of osteopenia. But in terms of who should get it, there are guidelines for who are screened, and it's based on a combination of risk factors and age. And so that's something, you talk to your provider about.
And it's more
But
the
I wouldn't
age and
say
what you're
that,
not just
right?
because you're
I
on a
wouldn't say
GLP-1.
it's just a routine,
Yeah. Yeah.
right?
Mm.
Is
I don't think even insurance would cover
yeah.
like bone
Yeah.
density
Right.
tests
If you are,
because of
yeah, for
Right.
example, if you're very
GLP-1s.
young, so you
Right.
take into the risk factors such as fracture history,
Right.
age, being on other medications that might affect the
Mm-hmm.
bones.
Mm-hmm.
Mm.
So
Oh, and just
yeah.
another note on the GLP-1, it is actually, initially it was actually studied as a medicine for protecting the bones because in animal studies, people who had knockouts of the receptors actually had cortical loss, and replacing it with GLP-1 actually prevented the bone loss. So I would say maybe there's more of a neutral effect and it's more of the weight loss part
Mm-hmm.
without maintaining muscle mass that is
Mm-hmm.
impacting the bones. So
Right.
I don't think someone on these medicines have to be, as concerned about screening bone densities unless they are having a lot and not maintaining their muscle mass.
Got it. Is there any impact to your brain health when using GLP-1s?
Right. Not aware that it directly impairs or improves your brain health,
Mm-hmm.
but if somebody is also doing diet and exercise at the same time, like a
Right.
healthy diet, a lot of exercise, that has been
Mm-hmm.
shown to improve the brain health. And
Mm-hmm.
we always recommend these medicines to be taken at the same time.
Mm-hmm.
But at the same time, with somebody who are on those GLP-1, I
Mm-hmm.
oftentimes see my own patients being super motivated right now.
Right.
It really psyched them up because they're
Right.
seeing results
They
in
get a
weight
great
loss.
bump. They're
Right.
like, happy
Right.
with
So
the weight
maybe
loss. Yeah.
emotional,
Right.
psychological,
Yes,
mental
right,
improvement.
that
Right.
affects
Right.
Yeah.
definitely.
It's sort of
And
the new. I was thinking we were talking about how like those liquid diets initially for people that used to have 50, 75, 100 pounds to lose in those first couple of weeks, and they lose all this weight. And they're like, all right, and then they're super motivated, and then you can kind of get into the diet of things. So,
right.
so there are a lot of questions about food and GLP-1s. So let's talk about that for a little bit. What foods would you recommend to eat for bone health, and what foods do you really recommend if you don't have an appetite? Let's start with the bone health one first. So what foods are generally recommended for bone health?
So bone health, there's few important nutrients. Calcium is definitely on the top of the mind in terms of for bone health, but also protein, magnesium, and phosphorus, vitamin K. There's also a lot of research on that for bone health. So the emphasis really on calcium because other nutrients, we don't need them as much. When I say other nutrients, specifically like magnesium, for example, even phosphorus, we don't need them so much. So we don't have such emphasis on the discussion. But calcium is very, very important nutrients. So that will be the first thing I would advise my own patients to make sure that they emphasize on getting enough calcium.
Where am I getting that from?
Food.
Where am I getting calcium from?
Dairy. Well, the largest source of calcium would be dairy. So if some people have a cholesterol problem, you could try, there's cottage cheese or Babylon light cheese, skim milks. That's most of my patients, they're concerned about dairy.
Right.
Or if they're vegan, like almond milk.
Well, the leafy greens have tons of calcium in it. There's certain fruits also have calcium, such as like figs, for example, or a great source for calcium.
Mineral waters.
Uh,
Remember, there's someone who used to recommend there was a sparkling mineral
Hmm.
water. It was super high in calcium, and
4 to 5.
patients I remember here in New York City would come in and they're like, "This is $7 a bottle. I was just told to get this." I'm like, "However you're going to get it, is how you're going to get it." So,
right. But I always want to emphasize, make sure get your calcium. Emphasize on food first. Food is the best source because they have less side effects. Calcium supplementation in high dosage and studies have shown actually can cause kidney stones, for example, and also calcification of
Right.
your arteries.
Right. Although these are large doses, so if somebody is really unable to get it through the diet, we say take a little bit through the supplement and a little bit through the diet.
Right.
But we just don't want it all through the supplement.
And more is not always better, right? And so,
Exactly.
right,
More is not better.
don't start taking 4,000 milligrams of calcium a day. That's not going to really help your bones.
Yeah.
So,
Vitamin D and calcium both have a curve.
yeah.
Too little and too much can cause
right,
side effects.
Yes.
Right.
right.
Absolutely.
And then
what about vitamin D?
Right.
Because it wasn't really mentioned.
Right.
Is it because I feel like since COVID, everyone's talking about vitamin D because it has so many functions, but is it really that important for my bones?
Absolutely. Can't emphasize enough about vitamin D. Absolutely. Vitamin D is calcium little helper, I call them. It is so important to get adequate vitamin D intake. And unfortunately, there are very few food that has vitamin D. So oftentimes, vitamin D is needed in supplementation. And that is probably the only nutrients that I would advise
Supplementing.
to take it as supplement.
But again, you want to do like a maintenance amount. There are some people who end up taking really, really high doses chronically, and then they come in with levels that are very high, and that can cause problems as well. So, yeah, you just need an adequate vitamin D to absorb the calcium, but not like too much either.
There was another question about appetite. So if you have a suppressed appetite, what is really most important to focus on in terms of diet? So especially with the GLP-1s.
Yeah, well, in terms of the GLP-1, and we're talking about skeletal muscle health here. So protein is by far the most important nutrients to emphasize on. So what are the protein food? Like animal protein foods such as like lean meats, chicken, turkey, fish provides a very high amount of protein per ounce. Right? For those folks who are vegan or vegetarian, you want to go with plant-based protein, eating like beans, lentils, nuts, seeds. Those are excellent source for protein. So yeah, so make sure that when you're on those GLP-1 and when your appetite is really suppressed, please do emphasize on eating
Get the
protein.
essentials.
Yeah, get the
Right.
essential.
Don't eat the cake as long as it's just a meal. No, that's not recommended.
Right. Don't eat the
No.
cake. Don't eat your pasta first. Just eat your protein first before you wound your appetite for other food.
So the next question is sort of along those lines: is what is the recommended amount of protein for an older adult, older female? And are protein drinks a recommended way to get protein? And what should patients look for in a protein drink? So let's start with the protein. How much is recommended? It's a little hard to gauge, like, without knowing someone's weight, but what would you say?
Yeah, so protein intake is individualized. It's based on patients' body weight. So generally speaking, when you're on GLP-1, you might need anywhere from, let's say, 1.1 gram to 1.2 grams of protein per kilogram of body weight. But again, this is very individualized. Some people might need more, some people might need less. It all depends on the diet we call and what that person is currently eating and what kind of activities they engage themselves in, as well as their body type, which is the BMI, and the weight status.
Do you regularly recommend protein drinks? Or what would be your indication for recommending one?
Now, somebody who's, if the appetite is severely suppressed and they're not able to obtain adequate protein from their food, by far, protein supplementation is definitely needed in that scenario. But regularly, again, like I do encourage every one of my patients to focus on getting nutrients, so their protein from food before supplementation.
If you are, there's the market is just saturated with protein supplements. So do you recommend powder versions? Are there brand names or just powder or liquid ones? I feel like the regular ones we see kind of people know about.
I think it's just individualized how, if they prefer to use powder one and make it themselves and adding whatever ingredients they prefer, then that will be the one for them. But they're all, a lot of ready to drink protein shakes out there, and there are bunch of them, and absolutely there are like thousands probably of different brands out there. You're like, which one should I choose and which one is appropriate for me? I would always tell my patient, look at the sugar content. If the sugar, the grams of sugar in that bottle of protein shake is significant, significant meaning like anywhere for, to me, in my opinion, anywhere for greater than 10 grams of added sugar in a bottle is a lot.
Because I don't think people realize is that when they're putting so much in these. So they're putting protein, but then they're often it's almost like a multivitamin. They put in all these vitamins, all these minerals that taste metallic. So they have to mask it somehow. There's either a really strong flavor, like a chocolate, a peanut butter, or sugar.
Right. And I think that's exactly what manufacturers are doing, is they're using sugar to mask the taste of the vitamins. And vitamins by itself, by the way, is very, very bitter. It's not pleasant to take. So they have to do that. But, look at the sugar. I prefer protein shakes that have very little sugar, such as like either 1 gram of sugar per bottle or 0 grams, and have higher protein content. I mean, you have variation of different protein shakes, right? You might have a protein shakes that only contains 10 grams of protein versus a protein shakes that might have 40 grams of protein. So the higher, especially somebody who's having appetite suppression, the higher the protein, the better.
And look at the food label, just flip it around, because I know recently a family member had said, oh no, we're drinking the blah, blah, blah high protein. and it's only 16 grams of protein. And I said, okay, well, if you're really trying to maximize, that's not even the equivalent of like a meal,
Hmm.
maybe a snack. I said, so there are ones out there with 30, 45 grams, depending on how much you're really needing in a day and looking to get.
Exactly. I
So,
think paying attention to the food label
right.
and understanding how much protein you're consuming in
Yeah.
that bottle is really
Yeah.
important.
Right.
Yeah.
So the next question is about is digestion related. So can GLP-1s cause constipation?
Yes.
But I think another part of that question
Right.
is sometimes what other GI issues,
Right.
really do
Now,
people get?
GLP-1s can have either, some people have loose stools and some people have constipation. So I always tell people who are having constipation, don't go overboard in trying to reverse it, or you may end up with the opposite problem.
Right.
Yeah. So, but yeah, I tell them to drink lots of water and have plenty of fiber. And Sue probably has a lot more recommendations.
Oh, yeah, the same thing. I think with constipation, obviously fiber intake and fluid intake is very, very important, but also exercise. When you
Right.
exercise, you're actually also moving your intestinal tract, and that also helps with constipations too.
Okay.
Mm.
So we have some questions about muscle and joint health. So do these medications, do GLP-1s really help with joint inflammation? It's not a direct
Right.
correlation.
I think if
right,
somebody
it would be.
has really high weight, that could sometimes they might have inflammation, and losing the weight might help with that. So, right.
So
And then
indirectly,
right,
it could
exactly.
help.
Yes,
Right,
indirectly.
exactly.
For
I
sure.
think, right, joint inflammation is different than maybe joint pain, but
Right.
I'm
It
thinking
could
maybe
definitely
that's
help
what
with
this question means.
arthritis.
Right.
When somebody has a lot of weight-related arthritis, like affecting their knees or their hips or their spine, losing the weight can help with that. Yeah, and I do want to also caution when we're talking about GLP-1 use, weight loss, and impact on bone, it might be slightly different in people who are, very high weight versus some people taking it who are on the leaner side.
Right.
So I do think that there are health benefits to take in people who are obese, overweight because of the arthritis, people undergoing surgeries, they have better outcomes in terms of the surgery being safer and more effective.
Which
so-
leads me right into
Oh.
the next question. So have the use of GLP-1s shown to, sort of need or indicate less need for surgery, like a hip knee surgery?
Right. Yeah. Some of the orthopedists at HSS are, having their patients in the lifestyle medicine program at HSS to help with not just through the medication, but also with the diet and exercise to help delay surgeries. Or if they still need to undergo it, to improve the outcomes from the surgeries.
Achieve a healthier weight loss or be on the path
Right.
to a healthier weight.
Right.
Right. So I think, GLP-1 helps patient in those scenarios where they need to have surgery and they need to be qualified to have surgery. It is an effective medication to help patients to lose weight prior to having a hip or knee surgery. Now, I haven't seen any research out there that will prevent somebody from having a hip or knee surgery.
Right. Sometimes they delay it.
Right. They can delay it,
Right.
but it doesn't mean that it will prevent them. So let's say somebody who's having advanced osteoarthritis, the damage to their joints already being done
Right.
by the arthritis. So it doesn't mean having the medication, the GLP-1.
Right. If you hear bone on bone,
Right.
It's
like it's
not
not yeah.
right.
Right.
You will need surgery eventually, but oftentimes I do hear many of my patients saying how great they feel after they lose weight.
The other thing, anecdotally speaking, that people over the years, when they have seen a provider, whether it's for weight loss, optimizing their diet or whatever, preoperatively, it puts them in a better health condition
definitely.
for surgery.
Absolutely.
And so I remember saying to patients, well, but then you have to remember, I said, you're working on all this now so that when you have surgery, that is not worked either. Because you're not even going to be able to get up out of bed without thinking about every movement. So this really helps kind of modify that part so that you can only then focus on the surgery and recovery.
Right.
After.
And there's also a population of patients where they're weight is too high, the surgeon thinks it's not safe to undergo surgery,
Right.
and being on these medicines or doing the diet and exercise can help them become like eligible for these surgeries that can really help them.
Right.
Absolutely. And they have a lot of research out there how shown just even losing 5%
Right.
of body weight and how that significantly decreased the risk for surgical complications.
Right.
So it is helpful
Yeah.
medication to aid in that aspect.
So we talked about weight-bearing exercises. I actually almost asked this earlier, but I'm glad somebody asked
Right.
it. What should people be doing if, we're talking about weight-bearing activity? I think people don't necessarily know what that means. And so then also, do we need to start lifting weights
Right.
or heavy weights?
Right. I think we'd also recommend, just like when people are thinking about the diet, seeing a dietitian, depending on their, other health risks or their bone health, it might be helpful to see somebody like a physical therapist. We also don't want to cause an injury if somebody starts to suddenly like carry weights that are too heavy for them.
Right.
Yeah. So you want to do it in a safe way too. But yeah, we're talking about like upper body and lower body strengthening through either resistance bands or weight routines. And there are some videos online, like melioguide.com. It's very helpful, although that's for people with like low bone mass. So some of these patients might be, not have that condition. So
So if I don't do any weight-bearing activity, or I don't know really what that is, do I have to join a gym? What do I do to get some weight-bearing activity?
No, actually, you don't. I mean, some weight bearing, very simple things, just taking a walk, for instance, it can be a weight bearing exercise and it could be a good. Building good habits, right? So if you're able to take like a 5-minute walk every day, why not do that? And why not slowly increment? If you're able to tolerate 5 minutes without giving you any pain or discomfort, why not do 10 minutes the next day? Like gradually, increase your exercise tolerance and go slow. Don't have a patient whom I saw just today and say, well, my doctor told me I need to exercise 30 minutes a day. And she was like, I never exercise in my life.
Right.
I'll be dead by doing 30 minutes. I'm like, no,
Right.
like you need to do it in increments.
Right.
30 minutes, try to do it
That's a
5
goal,
times a day,
eventually,
maybe
yeah.
perhaps,
Right.
like go with starting out 5 minutes and do 6
Right.
times a day and see how you feel. I was like, the most important thing I think is make sure you pay attention to your body because you know yourself the best.
Right.
No one else knows yourself like you do.
Right.
If I don't like people when they say, this, what is it? This no pain, no gain.
Right.
What they say is not true. What they're saying, you shouldn't be feeling pain when you exercise or
Right.
picking up in activities. If you do feel pain, that means your body is telling you, guess what? This might not be appropriate for you.
I always like to think of it as mental pain, like, oh, I have to go and do this now.
Right, but it
But
shouldn't
then
cause
once
physical
you're
pain.
but then
Right.
once you're done with it, you feel better.
Right.
You generally feel better.
Right.
Absolutely.
Yeah.
I think that's why it's so difficult for any one of us, right, to pick up exercise. It's the beginning, the first
Right.
step
Mhm.
to like really getting
Right.
yourself out there and doing it. And
Right.
once you do it, and sometimes doing self-talk also helps to push yourself forward, right?
Mhm.
And once you start doing it, you're like, okay, you know
Right.
what? This
Well,
is
I
not
think
so
also the word
difficult.
exercise
Right.
and physical activity. And for people, exercise is a very specific regimented form of physical activity. So generally what we talk about is trying to just be more
Right.
active.
Just move around
Yeah,
more.
it doesn't.
Right.
Exercise is
Mhm.
associated with the gym, or I don't know, like CrossFit or something. Doing
Right,
something
right.
that's so regimented for a specific
Right.
period of time.
Right.
Absolutely.
If you just walk more
Yeah.
instead of taking a cab or take the
Right.
stairs instead of the elevator.
That is
Right.
weight-bearing exercise,
Right.
taking
Right.
stairs,
Right.
Right.
Absolutely. Or sometimes even if you take the subway to work, getting a subway stop before
Right.
your actual stop
Right.
and just walk home.
Right.
True.
That's a wonderful way of getting exercise. And
Parking a little further from the store.
exactly, exactly.
Yeah.
And that is helpful, So exercise, it doesn't mean that you need to join a gym. It doesn't mean that you need to
Right.
Okay.
But if a
to
person
buy.
really doesn't know where to start, then usually joining a gym includes like a personal training session, and
Yeah.
then it can help orient them.
So we have a few more questions where I'm going to try to, squeeze them all in. So someone is asking that I have osteoarthritis in my knee. Is a GLP-1 going to help?
Like we said, it won't directly help,
Mhm.
or at least we don't have data for that yet, but it could indirectly help through weight loss.
Mhm. And then, so the next one is someone who's currently on Prolia
hmm
for osteoporosis. Will a GLP-1 affect this?
Well, in terms of the bone, um, a lot of it depends on the amount of weight loss and like how rapid it is. So we usually recommend people try to have a more slow and gradual weight loss.
The next question is, do GLP-1s really help with sleep? Like if I have sleep apnea,
Hmm.
am I going to feel
Right.
better? Am I going to sleep better after
Right. Well,
taking a GLP-1?
indirectly, because through weight loss, it helps with sleep apnea.
Yeah.
People with sleep apnea, if they lose the weight, they often, you know, they don't, their diagnosis
Got it.
is
Okay.
A
resolved.
matter of fact, sleep apnea is actually one of the
Mhm.
criteria the insurance company
Right.
will
Right.
approve.
Moderate to severe sleep apnea.
Will approve being on GLP-1. So, yeah,
Okay.
it does have an indirect effect. It does improve.
How are you determining the dosage to start for people?
Right.
Because I'm sure you see people, right, that
Mhm.
have been on one,
Right.
they need to
Yeah. So
switch, or
if
it's
they have to
indicated.
switch, we usually still start at like a medium dose, because if you switch to the highest dose of the other one, you could have a lot of side effects. So, yeah, if somebody's not responding as they'd like to, then that is an indication to try a different class.
And what do you
Um,
base your initial dose on? Is it
oh,
just
everyone
weight?
starts
Is
at
it
the
weight? Oh,
lowest. No,
oh,
yeah,
okay.
it's just
Okay.
standard, because it's just so that your body can get used to it, and you
Yeah.
don't have as many side effects, and you could tolerate it. So we always start at the lowest dose and go up slowly. Unless
Okay.
somebody's been on it, then we start in
And a
the
little,
middle.
okay. Are there any groups of people or really more specifically conditions that would not be a good candidate for a GLP-1? Like maybe someone after having
hmm
thyroid cancer or
That's not a
no?
contraindication. Just if they have a very specific type of thyroid cancer called medullary thyroid cancer, which is very rare in humans. Usually humans will have papillary, so that's not as much of a concern. But mainly it's if they have a history of pancreatitis, because there are some cases reported with the GLP-1s. We would use it with caution unless there was a very clear reason, and that reason had been resolved, such as due to like gallstones, and they had a surgery to remove the gallbladder.
Okay. All right. So if you're taking a GLP-1 and your A1C or BMI is in the normal range, you hit sort of what that goal is. Does insurance cover it anymore? That GLP-1?
I think
Do
it's
you know
all
that?
individual
Right.
from the individual's
Like the plan,
carrier.
the
Yeah,
carrier, the
Right.
plan.
exactly.
Usually,
So,
if you indicate they had a response, you have to just be very clear in your prior authorization that they started at this weight and they're now at this weight, and therefore continuing the medication is important.
Got it.
But I have had an instance where they did stop covering it because they met their goal, but then
Right.
the patient regained the weight and we had to restart
Oh.
them. And then they covered it again. So it didn't make
Right.
sense that
Yeah.
they didn't
Right.
cover
That it
it,
would have
but
been
it's
stopped. Right.
happened. So it depends
So
on the
we
insurance.
talked a little bit about this before the webinar started, but in terms of our last question is, what research are you excited about in this area? Because there's
Right.
so much, that we're finding out.
yeah, for me there's actually a new medication coming out with 3 different types of peptide hormones that I'm very excited to see what that will do. They say that right now is very promising. The research has shown that people are losing a lot more weight than the what is on the market right now. So, but it's not FDA approved yet. So that is in the pipeline. So that's exciting. And also it's very exciting to see what just the evolution again, like what I mentioned earlier about GLP-1, how it was meant to treat type 2 diabetes, but now it's just like there's so much research come out to support health benefits of other areas as well. So that's exciting.
And I think we also were talking before that there's an oral form that may be coming out that would be improved for weight indication. And I think a lot of patients
For those of you who don't
Right.
want an injection,
that might be
Yes.
exciting for them. But But yeah, I'm also interested in the area involving the GLP-1 effects in bone health because that's just the new area. So I feel like there's a lot more to find out
Mhm.
about that.
Thanks. I think that's our last question. Thank you so much,
Yep.
Sue and Dr. Kong, for being here.
Thank
Oh,
Thank you
you.
all
no,
for
thank you for having
joining us,
us.
asking your questions. Hope you got some useful information about this. I hope we answered your questions as specifically as we could have. And that is it. Have a good evening, everybody.
Good evening.
Thanks.
Thank you.
Thank you.
Bye bye.